Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25, you hear a physiotherapist talking to a patient named Sarah. Now read the question.
Good morning, Sarah. How are you feeling today?
I'm still experiencing some pain in my lower back.
I see. Today, we'll focus on some gentle stretching exercises to help alleviate that pain. We'll also incorporate some core strengthening exercises to support your lower back. I am going to teach you new adjustments you need to be doing with regards to your posture while sitting at office, and we can do that in a couple of days once you are free from pain.
That's fine. One more thing I wanted to know, it's about safe yoga practices that I can do daily. Maybe it can wait till I am over with this pain. We can talk about in our next session.
Question 26. You hear 2 nurses in a nursing home conducting a patient handover. Now read the question.
My main concern this morning is Irene. She's a 91-year-old female resident with moderate Alzheimer's disease. She's been in the facility for about 3 years now. Her daughter visits regularly, and the family is very involved in her care.
Okay.
Irene tends to wander during the late afternoon, especially around sundown. It's consistent with her sundowning behavior. We've been gently redirecting her back to the lounge or her room, depending on how agitated she seems. She remains continent, but needs prompting to use the bathroom. Mobility-wise, she uses a walker and requires minimal assistance. She also has osteoarthritis in both knees, which has been more troublesome lately. She says the stiffness takes a while to ease. A warm compress seems to help, and we've added that to her morning care plan. She's also been a bit hesitant to eat solids and prefers softer foods, so the kitchen is offering her a modified texture diet. She enjoys soft fruits and warm porridge.
Question 27. You hear the beginning of a training session for nurses about to start work on a pediatric ward. Now read the question.
Today, we are focusing on care practices in pediatric nursing. Unlike adult patients, children are far more susceptible to medication errors due to factors like their smaller body weight, developmental stage, and often limited ability to communicate adverse effects. That means even minor discrepancies can have major consequences. So, when you're preparing medications, always use weight-based calculations, double-check dosing guidelines, and ensure you're working with the most current pediatric charts. For infants and neonates, microgram-level accuracy is often required, so being meticulous is critical. One of the key tools you'll use is the pediatric medication chart, which includes vital information on drug compatibility, dilution instructions, and administration rates. We'll also walk through the use of smart infusion pumps and oral syringe labeling. Every step, from prescription verification to administering the dose, must be carried out with extra vigilance. In this session, we'll take a look at real-case scenarios, review the top 5 most high-risk medications on the ward, and practice calculating and charting doses using sample cases. The goal is to reinforce safe practice habits and build your confidence before you're working directly with young patients.
Question 28. You hear an occupational therapist preparing a trainee for a visit with a post-operative orthopedic patient. Now read the question.
Okay, so the first patient this morning is Mr. D'Souza. He's 72 and recently discharged following a total knee replacement on his right side. He lives with his wife, who's supportive, but she has arthritis herself and can't really assist with heavier tasks.
Right.
Today's focus is helping him adapt to the bathroom setup. He's managing reasonably well with the walker, but he's still quite tentative about navigating the wet area. So we'll be looking at how he moves in and out of the shower safely, reviewing grab rail positions, and trying out the shower chair.
Understood.
If that goes well and he's not too fatigued, we'll also assess how he manages in the kitchen, something simple like reaching for items from cupboards and doing a bit of food prep while maintaining balance. The idea is to gauge how safely he's moving through everyday tasks and boost his confidence so he doesn't feel too dependent. However, we may not get to do that today. We'll also talk to his wife about pacing and not overexerting himself.
Question 29. You hear a hospital pharmacist advising a patient about a different medication and concern. Now read the question.
So, how are things going with the metformin you've been taking for your type 2 diabetes?
Honestly, it seems to be working. My blood sugar's been more stable lately. But I've been getting a bit of stomach upset from it, especially after breakfast.
That's not uncommon at the start, especially if you're taking it on an empty stomach. Are you having it with food?
Not always. I usually take it right after I wake up and then get around to eating later.
Okay, try to take it during or immediately after a meal. It helps reduce those side effects.
Got it. Also, I read somewhere that long-term use can cause vitamin B12 deficiency. Should I be worried?
That's a good question. It can sometimes affect B12 absorption, but we'll keep an eye on your levels through routine blood tests. If needed, supplements can help.
Thanks. I was thinking of cutting the dose down a bit on my own.
I wouldn't recommend adjusting it yourself. Let's track your blood sugars and review the dose at your next clinic visit. We want to keep everything balanced.
Question 30. You hear a primary care doctor discussing with a patient. Now read the question.
So, what brings you in today?
I've been getting these really persistent headaches lately, mostly in the afternoon and sometimes when I wake up. They're dull but really draining.
I see. How long has this been going on?
Probably about 3 weeks now. At first, I thought it was just stress from work, but it's not easing up, even on weekends.
Have you had any issues with your vision? Or nausea with the headaches?
Not really nausea, but I have noticed some blurry vision when I've been staring at a screen too long. Do you think this is related to migraines I used to get a couple of years ago?
It is possible. I need to review you thoroughly to confirm. Have you changed anything recently? New medications, different sleep schedule?
Well, I have been staying up later than usual trying to finish a big project, and I've skipped breakfast a lot over the past month.
That might be playing a role. Let me do a quick neurological check and take a look at your neck and shoulders as well.
Sure, no problem.